changing smiles, changing lives.
Now I want to ask you a tough question. So, what makes you different compared to the other dental practice here in Dubai? I know there is a lot of competition here. Don't tell me about the marketing side, the marketing version. Tell me exactly what do you feel, why you are different.
Um, Greta, I can just say that there are some very, very good colleagues in Dubai. I will never take it away that we are in a land of abundance. We have great dentistry here. I'm not trying to take it away. In fact, in a small city, we have some very skilled dentists. So kudos, and I give all my respects to all the clinicians out there who do good dentistry. But I sometimes feel that those good dentists are in different practices. So if I was to pick up A specialist, he's in one practice, and then B specialist, he's in another practice. And sometimes they are restricted by aligning themselves with only the lab that the practice owns, and they cannot experiment. They cannot say, okay, for this particular patient, I'm going to use another technician. They have to work with one person. So there are limitations within practices that I see. And they might not be, and they might be in line with what we stand for. But I think the two things that set us apart, and I'm not trying to say location opposite the Four Seasons or you come and park easy, which was the reasons why we chose the location. But I think what we really, really stand apart from is that we have a very small practice by Dubai standards, but we have a very powerful practice. We have very, very powerful dentists who are working there, who are authorities in their own field. They are icons of credibility globally. So the root canal specialist I have, Dr. Siju, the orthodontist, Dr. Firaz, Valerie, who's a dentist who's teaching photography in Latin America, apart from being in the gym. Caroline, who's my general dentist, Stephanie, who's a general dentist and is always on a course and trying to upgrade herself, Lali, everybody, Anvisha. All these people add a very special individual impact to the practice. And one of the things that I find that we do best is that we work together. It isn't ego that is making me take something away from somebody. We are contributing to each other's growth. And that is very, very rare, especially when you're not working on a retainer, especially when you know if I try to do some extra work here and there, I can make a little bit more money. But trust me, everybody in the practice will give the best person the job to do because he's good at doing that and that only. And that gives me great pride. If I'm traveling for days when I do for my lectures, it gives me great pride and it gives me so much solace that nobody here is going to not do what's not right for a patient. And that's always been my philosophy, what drives me. That's always been something that I've been very passionate about. And I can truly and really say, looking at the camera, looking in people's eyes, that we are a practice which really, really puts in the effort to be ethical and to do what we call as responsible dentistry towards you.
So now let's talk about philosophy and approach. What is your philosophy about cosmetic dentistry?
I don't think, Greta, it's just about cosmetic dentistry. I think it is whenever somebody walks into the office, and I can tell you that one of my junior colleagues, Valerie, sets an example of doing so because she, when she looks into and diagnoses a case, it is like she's reading their whole book of, records, and she's trying to examine everything very, very keenly and intensely. And why I'm stating her name is because she's the youngest of us, but she's taking care about everything to see and holistically treat somebody. And what I find is that we generally become like, let's say there's a car which has many needs, which needs repair for tires, for brake pads, for gearbox, for engine repair. And I go and say, I have a leaking radiator. The mechanic fixes it with something, with whatever, 15, 20 minutes and says you can drive. And then tomorrow I'm back in the garage. Then I'm back in the garage. So it's better to have a full diagnosis, to have a plan of what I need to do with this car, how I need to fix it from A to Z. And then based on my budget, my temperament, my priorities, I choose and do whatever I want to. And what is at the heart of the practice? And when we look at somebody, and we are not shy to tell you that this is not right for you, for your health, or for your mouth to begin with. and everything starts from the oral cavity, right? So my point of view is very simple, that when you come to our office, we are not giving out numbers because we want you to be treated. We will take your x-rays. We will spend time on you. We will do the diagnostic tools that we need to have, and we have the best. We will take all the photographs. We will check your bite. We will check everything that is needed to be checked to give you a complete global information. Not to tell you, oh, because you're here in pain, let's do a root canal. And then tomorrow I start telling you, you have 2 more cavities, you have 1 more filling. By the way, your bites very often, let's try and do orthodontics. But after the orthodontics, you're going to need some veneers. I see many practices doing that, just trying to say, let me make what I can make today. But that is never our ethos. The principle and the way that we practice, from the youngest to the most senior person who is seeing a patient when they walk in for the first time, is that I am in charge of your health and your well-being. We are going to tell you what's good for you. We are going to introduce you to the best guys in the business for that particular job. You take it or leave it is entirely up to you. And I tell everybody in the office, please, when somebody comes, don't be shy. And they would be like, I don't think maybe he's going to go ahead with this treatment. It's been so many years. They've been neglecting themselves. And I said, that's okay. You don't have to be another one in the list who didn't tell them what's good for them. At least you will sleep with peace, and you will sleep in a way that you feel you did your best for the patient. And that's what it is.
And why did you choose to be focused on aesthetics?
So aesthetics, I think, is something that naturally came to me as a part of when I was learning and doing dentistry. Actually, I was very good at maxillofacial and oral surgery. I was a junior surgeon resident for a year. I was suturing the scalp. I was treating cancer patients with my maxillofacial surgeon, and he told me, you have gifted hands, become a surgeon. But, as they say about Spider-Man's uncle said to him, Peter's uncle, with great power comes great responsibility. And I think I felt like it was too much of responsibility. And I saw maxillofacial surgeons having to stay with hospitals, treat patients at odd hours. And at the same time, I was developing so much love for working with my hands and crafting something which was very delicate, minute. And I started working with resins, and I started working with color. And I thought it was fashionable. I thought it was very nice to have different colors being put into teeth and to try and see how they reproduce in nature.
I connected with creativity and your art
Absolutely,
side as well.
absolutely. So it was more to do with the fact that I felt home when I started to create a broken tooth or create something out of wax which looked like a tooth. And I was very fast. And a lot of people used to tell me, oh, I don't feel like doing my assignment. Can you carve these teeth for me? And I was like, okay, here you go. So I was doing it very fast. So I practiced much more than I had to. But I think over a period of time, I also realized, and I felt somewhere in some way, that when I am able to comprehensively treat somebody, and when they have a good aesthetic outcome, it actually changes lives. And I even write on our social sometimes hashtag, I say, changing smiles, changing lives, because that is so powerful. I can tell you, so many people haven't smiled in years. So many people feel miserable because they can't go out, because could be one missing tooth, one dark tooth. They have shame. Kids today feel shame when they're young, when they're losing some teeth and they don't understand why, or if they have very yellow teeth.
Can you share with us one story that comes in your mind that really touched your heart?
There are so many stories. I think it's an everyday story.
One that make you cry.
I think it was one of these situations where there was a girl who had neglected her teeth a lot, and her parents were coming to me, and she was feeling very embarrassed in school and in college. She was being bullied because she had kind of freckled skin, but at the same time, she didn't have good looking teeth, and she had certainly abused them by a lot of soft drinks and juice and whatever, unfortunately. And I took the step of doing her teeth very, very conservatively as much as I could. But I realized that if I don't do something with her teeth now, she won't have teeth till she's 30. And the day that I finished her teeth, she couldn't stop crying. She looked in the mirror as if it was somebody else. And, years and years and years after, also her parents keep thanking me that I kind of gave her a youth that she was missing out. And every time they come and they're like, "Oh, she's so happy with her teeth, Ajay. You did so well. It's been 10 years, but we feel so good. Thank you so much." So that gratitude is so powerful, and
How did you feel about it?
I feel like crying when you see that happen. Um, yeah, it's very powerful.